Hello, I'm Tydeman. I'm a consultant obstetrician for over 25 years and I invented the first impacted fetal head simulator, and I'm here with Izzy.
Yes.
Thank you for joining us, Izzy. You're now a junior consultant here. But of course 10 years ago when we developed the first one, you helped us out evaluate that first simulator.
I did.
So this is Debra Enhanced.
Okay.
And we've enhanced the design in several key ways for several reasons. We're aware of the impacted fetal head being a much bigger clinical issue than we were even 10 years ago. We now know, for example, that of all babies damaged in childbirth with hypoxic problems, in about 10% of them, the impacted head's important.
10%?
Yeah.
That is very high.
We're also aware that people are using push-ups more, and we're aware of people using devices like the balloon inflation device, which has been around for some time, and coming out this year, my device, the Tydeman tube. I'm just going to talk you through the enhancements that we've made. Firstly, significant changes to the baby's head. The fontanelles are easy to palpate, the suture lines are easier to feel, but also underneath the silicone are actual skull plates, so they move and float in the way that a real baby's head does.
So it's very realistic.
Yeah, we've tried to make it as realistic as possible. And importantly, the vaginal examination is much improved. So the head will descend lower to a lower station. And it will allow people to practice push-up, allow people to practice vaginal examination, as well as allow people to use those devices. So what I'm going to do now is put the baby's head in there.
Right.
And as in the past, I can adjust the degree of difficulty. But for this example, we're going to do them all on a kind of only moderately difficult setting, nothing too severe. I can put the baby's head in any position I like, either outside or once it's inside. I can alter the degree of flexion or extension, even to the point of being a face presentation or certainly a brow. And also, in the process of delivery, I can see what the trainee's doing. So I can see if you're rotating that baby's head as you're delivering. I can see if you're flexing it to make it more easy, which is a lot of people believe in. So without further ado, I'll put the baby's head in. I'm going to put it into a position. Okay, so now if you'd be kind enough to do a vaginal examination, I'm also going to simulate a uterine contraction by pushing on here, which I think happens quite a lot when you first make that incision. But so if you could do the vaginal examination,
so I'm doing a vaginal examination.
And talk us through it, see what you think.
So what I'm doing is I'm trying to obviously assess, we are fully dilated, and I'm trying to assess for the position of the baby's head in relation to the maternal pelvis. And on palpation, I can tell that this baby is facing what we would describe as LOT. And also, actually, the baby's head is really low, so the station is below the spine. So that's a different enhancement from the last model, I believe. So I would say this baby's head is moderately flexed.
And off the record, that ties in exactly with what I've got on the indicator here. Rolling forward, we've done the incision for you. If you could now do the caesarean and talk us through what you find.
So, in doing a fully dilated caesarean, for me, what's key is to make sure my position is optimal in relation to the patient. So I would make sure I was high up as possible, because I'm not gifted with height. And in getting my hand right below the baby's head, so I want to get my hand as low as I can get, and I want to lock my shoulder. I want to absolutely keep this nice and straight, making sure I'm not wriggling at the wrist, because this is what will cause the trauma and put me in trouble with regards to the uterine angles. And once I'm below the baby's head, what I'm trying to do is to flex that wee head as much as I can, and then I'm bringing it up gently through our incision and delivering this beautiful baby. Let's call her Izzy.
Thank you.